working as a nurse, I was always leery of unnecessary medical intervention in children. I rarely give my own child medications in order to allow his body to naturally fight off infections. I was one of the people who viewed tube placement in children as unnecessary and overly used, but who would have thought years later I'd be working at an ear, nose, and throat clinic assisting physicians in doing just that. So now I view tube placement in a different light. Many people are skeptical of tube placement. They see it, like I did, overly used and unnecessary, but I'm here to discuss the benefits and advantages of this procedure. Many of you have probably at some point in your life experienced an ear infection, and you could also have experience with the procedure. Maybe you had tubes placed as a child, or your own children may have had tubes placed. You could also be one of the people who are skeptical of the procedure, and I would just like to bring some light into the procedure itself and its advantages. I've worked at an ear, nose, and throat clinic for the past 9 months, where I've assisted physicians in tube placement when it's done in the office. I've also read many books and articles regarding the advantages of ventilation tubes in children. Today I'm going to be discussing the procedure myringotomy with insertion of ventilation tubes. I'll be discussing its advantages and disadvantages, as well as additional treatment options, their effectiveness versus the effectiveness of tubes. Charles M. Bauer defines acute otitis media as the rapid onset of inflammation in the middle ear. In the U.S. alone, 8.8 million children under the age of 18 were reported as having ear infections in 2006, which is a pretty big number. Charles Bauer also defines otitis media with effusion as the presence of fluid in the middle ear without signs or symptoms of acute otitis media. So now that we know the definition of the two disorders, we can talk about the causes. One of the causes is bacteria and viruses. So there was a study done in 79 children where they cultured the fluid in the ear. In 66% of the cases, they found bacteria and viruses. In 27% of the cases, they found bacteria alone. And in 4% of the cases, they found viruses alone. Another cause is secondary to upper respiratory infection. So children will present with an upper respiratory infection followed by ear infections. And last, the positioning of the ear canal in infants changes over time, and the position of the ear canal as infants often causes ear infections, and that resolves over time. So the fact that bacteria and viruses are a cause of ear infections means that antibiotic use is prevalent as a treatment option. Charles Bluestone states that the antibiotic of choice in the treatment of ear infections in children is amoxicillin. Antibiotics are great. They are effective in treating otitis media with effusion and acute otitis media in children, but there are some negative side effects. So in the 2014 Lippincott's Nursing Drug Guide written by Amy Kark, the negative side effects listed for amoxicillin include lethargy and confusion, nausea, vomiting, and diarrhea, and superinfections. So, with that being said, that's why I want to talk about tubes, because tubes do have some complications involved, but they are very small. It's a rather simple procedure. The procedure itself is taking place in less than 10 minutes. There's little to no recovery time where the children need to miss school or miss activities. And children do need to wear earplugs after the procedure when taking a bath or participating in any other water activities for comfort reasons. We don't want water to go into the tube because that can be pretty painful. Complications of acute otitis media or ear infections and effusion or fluid in the ears are hearing loss, speech delays, and vertigo. So in infants and children, or infants and toddlers, it's a high developmental time for them. So we want to resolve these issues before these complications can take place. Dr. Thomas Hammond has stated that the Academy of Otolaryngology recommends tube placement in children who have experienced 3 or more ear infections within 6 months' time, or 4 or more ear infections within a year's time, along with fluid in the ears. They also recommend tubes placed in children who have fluid in the ears along with speech delays. Some of the disadvantages, as stated by Dr. Thomas Hammond, are the use of general anesthesia. So young children are placed under general anesthesia for this procedure, and the risk of that are damage to teeth and damage to vocal cords. There's also a small risk of perforating the eardrum during the procedure. Eardrum perforation is also referred to as bursting the eardrum or a hole in the eardrum. Another complication, of course, is high cost. We all know that the rise in cost of healthcare is coming along, so that's a disadvantage of the procedure. But also, as stated by Dr. Thomas Hammond, the advantages of the procedure are improved hearing, improvement in speech delays, less ear infections, and less use of antibiotics. One of the greatest advantages of these 4 things is the improvement in hearing. He has stated that this is a high brain development time for young children, so we want to get this resolved as quickly as possible, as I've stated earlier. The reason some people are skeptical of this procedure is that over time, ear infections will eventually resolve. As children get older, they tend to have less ear infections, and when the ear infections resolve, so does the improvement in hearing, or so does the hearing loss and speech delays. The thing about that is that if we do not resolve the ear infections and fluid in the ears as soon as we can, children are losing out on improving developmental stages during that time that we're waiting for it to resolve on its own. So, as I've mentioned to you in this speech, the advantages and disadvantages of this procedure are obvious. And even though people are skeptical of the procedure, the benefits far outweigh these suggestions. If your child is experiencing multiple ear infections or fluid in the ears, I would like to advise you to seek advice from your local otolaryngologist. Your children will thank you later.